Aloha mai kako, my name is Anela Benson, and I am presenting on advanced directives, end-of-life care, and physician-assisted death. I decided to concentrate on this area of long-term care, primarily because I'm a former caregiver, and essentially these were some of the toughest decisions and the hardest phase of long-term care that I had to experience. Hence, especially going into the long-term care field, I want to ensure that our residents and their families are prepared. That way they don't have to make these decisions under such stringent time constraints and while they're highly emotional. Here's an overview of my research. In long-term care, the right to dictate your own decisions for life and death matters is an integral aspect of autonomy and dignity, which are significant factors in delivering healthcare with compassion and quality care to our residents. The following research delves into the ethical and legal issues pertaining to advanced directives, end-of-life care, and physician-assisted death. Autonomy and advanced directives have become sources of great legal and ethical concerns as the balance between self-determination and dignity and morality and ethical duties as healthcare professionals. Advocating for residents to determine their own advanced directives, end-of-life decision-making, and assisted death rights ensures their autonomy, promotes compassionate care to minimize their suffering along their end-of-life journey, and enables them to die with dignity. Here's my thesis statement. As previously stated in the introduction, that advocating for residents to determine their own advanced directives, such as end-of-life decision-making and assisted death rights, ensures their autonomy, promotes compassionate care to minimize their suffering along their end-of-life journey, and enables them to die with dignity. Some of the main points that I wanted to address in this research is essentially autonomy, which ensures self-determination in all aspects of residents' healthcare and end-of-life choices. Compassionate care, plotting out advanced directives and end-of-life decisions early can help to ease transitions from one stage of care to another, minimizing pain or suffering for the residents. And dignified death, advocating for healthcare policies that support individual rights to end-of-life decisions enables them to die with dignity. So autonomy, by definition, is essentially the right to self-governance, and it's one of the most fundamental principles of ethics in healthcare. It asserts that individuals should have the freedom to make decisions about their own bodies and lives without coercion or interference. In the context of healthcare, autonomy means the right of individuals to choose their medical treatments, and in the case of terminal illness or unbearable suffering, the right to make end-of-life decisions. And so a subcategory under autonomy would be advanced directives. And so for advanced directives, essentially these are legal documents that allow individuals to outline their preferences for medical treatment if they become incapacitated, in which they cannot make these decisions for themselves. These directives allow the individuals to make their wishes clear regarding life-sustaining measures such as mechanical ventilation, artificial nutrition, and resuscitation efforts. In situations where a person is unable to communicate their wishes, an advanced directive ensures that healthcare providers honor the individual's preference. The recognition and enforcement of advanced directives preserve autonomy by ensuring that a person's wishes regarding their care, including end-of-life decisions, are respected. According to a study published by the American Journal of Hospice and Palliative Medicine in 2019, So that advanced directives allow patients to express their desires for end-of-life care and reduce unnecessary medical interventions, which can prevent patients from undergoing aggressive, unwanted treatments that compromise their dignity. The study highlights that when patients have control over their medical decisions through advanced directives, they experience better overall satisfaction with their healthcare and quality of life in their final stages. Furthermore, autonomy encompasses the right to refuse treatment. Even if refusing treatment may lead to death, individuals must have the right to make that choice. The ethical principle of respecting a patient's autonomy allows them to make informed decisions considering the risks and benefits of treatment. This is particularly important in cases where the individual faces a terminal illness or irreversible condition. In such cases, patients should be empowered to determine the course of their treatment, including the decision to forego life-extending procedures if those procedures would not improve their quality of life. The second key point was compassionate care. By having the ability to make end-of-life decisions, it also carries significant psychological and social benefits for both the patients and their families. Facing the uncertainty of terminal illness can be psychologically taxing, and having control over one's final moments can bring comfort to both patients and their loved ones. Research shows that patients who have the option of assisted death report lower levels of anxiety and depression, knowing that they have the power to avoid unnecessary suffering. A study published in JAMA Internal Medicine in 2017 found that patients who made end-of-life decisions, including creating an advanced directive or opting for physician-assisted death, experienced greater emotional peace. The study followed individuals in Oregon where physician-assisted suicide or euthanasia is legal, and found that the majority of participants reported feeling relieved, not only because they avoided the pain associated with the terminal illness, but also because they had the autonomy to make their own decisions regarding their end-of-life care. Moreover, for patients with terminal illnesses, making decisions about end-of-life care can foster a sense of closure. Knowing that they can control their death, whether through an advanced directive or assisted death, helps patients feel that they are not helpless in the face of the illness. It also relieves families of the burdens of making difficult decisions under distressing circumstances. On a social level, end-of-life decision-making can encourage open discussions about death and dying. In many cultures, death remains a taboo topic, and individuals often do not express their wishes for the end of life until it's too late. By making end-of-life decisions, such as creating an advanced directive or discussing assisted death, patients can ensure that their wishes are known and respected, sparing their loved ones from the emotional strain of decision-making at a time of crisis. And the third point pertains to dignified deaths. Assisted death, also known as physician-assisted suicide or euthanasia, remains one of the most contentious topics in medical ethics and law. Despite the opposition from various religious, cultural, and political groups, there is a growing movement advocating for the legalization of assisted death in certain circumstances. This movement argues that assisted death is an extension of a patient's autonomy and dignity, allowing them to avoid unnecessary suffering when faced with a terminal illness or irreversible condition. One of the primary ethical arguments for assisted death is the principle of beneficence, which asserts that medical professionals should act in the best interests of the patient, promoting their well-being. If a patient is suffering unbearably and has no hope for recovery, assisting in their death can be seen as an act of compassion. Rather than prolonging suffering with futile interventions, assisting in a peaceful death provides relief and ensures that the patient's dignity is maintained until the end. Research published in The Lancet in 2018 supports the argument that physician-assisted death can lead to greater comfort and reduce suffering for terminally ill patients. The study, conducted in the Netherlands, where euthanasia is legal, found that most patients who chose assisted death did so to avoid unbearable pain and a loss of dignity. These individuals reported lower levels of anxiety and distress, as they felt empowered to take control of their own death rather than being subjected to protracted, painful medical procedures. Additionally, proponents of assisted death argue that respect for autonomy is central to ethical medical practice. Individuals should be given the freedom to decide when their life should end, especially when faced with intolerable pain or the loss of quality of life. In countries or regions where assisted death is legal, strict regulations ensure that the decision is voluntary, informed, and made without undue pressure. This safeguard is crucial in ensuring that the practice respects the person's autonomy while maintaining ethical standards. In conclusion, it says that the right to make end-of-life decisions, including the use of advanced directives and the choice of assisted death, is a crucial component of a compassionate and ethical healthcare system. These decisions empower individuals to exercise their autonomy, protect their dignity, and avoid unnecessary suffering. By embracing these rights, societies can ensure that patients are treated with respect and care, fostering a more compassionate and humane approach to death and dying. The ethical arguments in favor of advanced directives, end-of-life decisions, and assisted death are grounded in the principles of autonomy, dignity, and beneficence. Legalizing these practices and promoting a culture that values personal choice in healthcare decisions is an essential step toward ensuring that patients have the power to control their own destinies. As society continues to evolve, it is important that the law and healthcare systems adapt to reflect the values of autonomy and compassion, ensuring that everyone can face the end of life on their own terms. Here are some of my references that I used. And the questions that I pose to you folks is: 1, should the right to die be considered a human right, or should it be determined by social norms defined by religion and governmental policies? And number 2, how can healthcare systems ensure that advanced directives and assisted deaths are voluntary, well-informed decisions and alleviated of any external pressure or coercion? Thank you folks so much for listening to my presentation. Have a wonderful evening and enjoy your winter vacation. Aloha.